MCDHH testifies for Joint Ways and Means Committee Fiscal Year 17 budget hearing. Hello, I'm Heidi Reed, Commissioner for the Massachusetts Commission for the Deaf and Hard of Hearing. MCDHH recently provided testimony for the House Ways and Means Committee. We provided testimony about the Governor's House 2 budget for fiscal year 17. That budget proposes funding for MCDHH's programs and services through fiscal 17. Our comments included in the testimony are our significant achievements for MCDHH for the past year. We focused on 3 major achievements: the Americans with Disability Act, ADA compliance for programs and services to improve and be in compliance with ADA. Through many collaborations with state agencies, we've improved access for deaf and hard of hearing. The second is to improve the business services for various state agencies for deaf and hard of hearing individuals to access their services, to become more effective at providing services to deaf and hard of hearing people. For example, healthcare professionals. We've done intensive trainings, provided support and technical assistance to ensure provision of access is successful for deaf and hard of hearing people. We focused on quality assurance and improving our workforce for interpreter services, to expand the number of interpreters who are qualified to work with MCDHH to provide access in a variety of settings, such as medical, mental health, legal, and substance use disorder programs. MCDHH's programs and services are the bridge connecting individuals who are deaf and hard of hearing to a full range of state agencies and services. We work closely with other agencies to build their capacity to provide services to deaf and hard of hearing people. Our core services are interpreter and CART, communication access and training and technical assistance, case management for adults and children's specialists, a contract with deaf and hard of hearing independent living services. All of these are included in the House 2 budget for MCDHH services. We do intensive work with crisis intervention. Some of our most significant partnerships, for example, now we have a new agreement for Department of Children and Families to make it possible for deaf and hard of hearing people to be served through DCF programs, to effectively work with communication access to achieve their goals. And this was completed, our MOU, Memo of Understanding, was completed for fiscal year 17. We also work closely with the Department of Public Health. DPH has a newborn screening program which identifies infants who are born with a hearing loss. We estimate about 200 children are born with a hearing loss every year. This connects their family to early intervention services and support. MCDHH works closely with the Department of Public Health to address the needs of access for substance use disorder services. Our statewide model of substance use disorder access makes it possible for deaf and hard of hearing people to achieve access to inpatient programs, outpatient, as well as 12-step programs across the state of Massachusetts. During the year, MCDHH works with a multitude of agencies: the Mass Office on Victims Assistance, the Massachusetts Rehabilitation Commission, Massachusetts Commission for the Blind, DCF, and so forth, with the same goal: to make it possible for deaf and hard of hearing people to access services statewide. The Governor's House 2 budget is proposed funding for MCDHH. That funding shows a 4% reduction. The reduction is from cost savings from the early retirement that happened last year. How will this influence us? How will we approach the cost savings? We will work closely to analyze the programs and services that we have internally within MCDHH. We will look at the programs and services we have available and look at the needs that are addressed statewide through those programs and services, addressing the critical needs that are required. Through this assessment, we will make the necessary changes in the upcoming year and work closely with staff and the funding that we have to meet the critical needs of deaf and hard of hearing individuals statewide. The services we provided this year will continue throughout the fiscal year of next year. And what is next with the budget process? The House Ways and Means Committee will have a hearing for public comment on March 4th. That will happen at the State House in Boston. This is an important opportunity for the community, those who are deaf and hard of hearing, people who are concerned with state services, to come together and comment on the House 2 budget. This is the opportunity to provide testimony on March 4th. Your involvement, participation, comments, and perspectives are important. March 4th is your day to testify at the House Ways and Means Committee. MCDHH has already testified for the House Ways and Means Committee for fiscal year 17. Now it is your opportunity to go on March 4th to testify in front of the House Ways and Means Committee. Thank you for your involvement and your support. The Joint Ways and Means Committee will hold a public hearing on the fiscal year budget Friday, March 4th, beginning at 10 a.m., Gardner Auditorium, State House, Boston. ASL interpreters and CART have been requested.